Well, I want to share the sentiment of saying it's great to be here in person. We've got a presentation tonight that's our results for year ended December 31st, 2021. We just presented this to our institutions this week. We announced results on Tuesday. So I want to walk through what we've done and then talk about what we're going to do this year. So thank you all for coming, and there's quite a few slides, so if I go forward a little bit quickly, you'll understand at the end. There's a disclaimer if everybody wants to take some time to read it. You've probably read it before in other presentations, so we won't take too much time. Executive summary. What is SourceBio? We're a leading provider of clinical and drug development laboratory services to blue chip pharma, NHS, and private hospitals. 2021 was an exceptional year for the business, both financially and operationally. We had focused on COVID. I will say this before I get into this. Focus has switched from COVID to acceleration and development of our core business units. We were a very successful life sciences business that was particularly active in the cellular pathology space. And we saw the impact of what was going to happen when elective surgeries were put on hold effectively, and it really would have decimated the business. We probably wouldn't be sitting here right now. We decided to pivot into COVID as a hedge, and it turned out being a significant success and enabled us to generate significant earnings and growth that enables us to invest back in our organic businesses. So that was the strategy. We've executed on it. We've done that. I just want to point out that COVID's still here. It's still part of our business, but it's not considered core. We've got an M&A pipeline deal that we've been working on. We just closed an acquisition of a company called LDPath. That's London Digital Pathology. Excellent addition to the business, closed in March of 2022. We'll talk more about that in the presentation. COVID PCR testing was an extremely successful hedge, I mentioned that. But modest COVID testing remains. It's a non-core activity. What we're seeing is there's still demand for COVID with hospitals that want to make sure nobody has COVID going into a surgical suite or an ICU. So you're going to have ongoing COVID testing. Let's call it 700 to 1,000 a day. It's not a bad business, but it's certainly not going to be what it was, and we know that. But we're investing in the base business, and we took the cash we generated from COVID and are investing it. We've done that. LDPath is an example. 21 highlights, strong financial performance. Revenues up 82% to $92 million, $50 million in 2020. Gross profit increased to $36 million. Adjusted EBITDA 24 versus 14.2 in 2020. EPS up, cash generated from operations, $32 million. We closed the year end with a cash balance of $33 million, which we are now using to deploy into strategic acquisitions. This gives you an understanding of the size of our base businesses. Now let's understand that CellPath was impacted by COVID. So these are rebounding businesses. I will say though that we are seeing elective surgeries come back on. There's a slide later on where I can show you the volume of casework that's coming through, so that is coming forward. But there's also an underlying demand for cellular pathology that we're going to continue to meet, and we'll talk about that in a minute. Genomics, great business, up 18%. Stability storage, we'll talk about that. There's some masking of growth going on in there, and I do want to talk about that. So overall, the core businesses are up 19%. Infectious disease, which is our COVID business, was up substantially. And so total revenue's up 82%. So I think this was a very strong year for us. I don't think there's anything else I want to talk about on this slide. This is, for those of you who haven't seen this, because I know some of us have seen this presentation, this graphic. Basically with cellular pathology, if you've got cancer, you get your tissue sample taken either at a private hospital or NHS hospital. You will either send those tissue samples to us, or you'll have a pre-prepared slide that's got a tissue on the slide already sent to us at Source. We will then log that into our system. We do wet work and prepare slides ourselves. We will then send those slides to a pathologist who will take those, look at a microscope, give his diagnosis, send the slides back. We will take the slides, prepare a report, and then send the slides back. I'm highlighting these slides on purpose because what digital does is it takes all these slides out of here. We're now working on putting digital scanners in these hospitals where they can literally scan on site and they can send us the digitized images, which then we can send right to our pathologist. Why is that important? Because right now, average turnaround time is 5 to 7 days to get a diagnosis. LDPath especially has done that in 24 hours. So patient care is greatly improved, speed to results are greatly improved, treatment times are better. This is where the industry is going. I want to point this out. I think I mentioned this earlier. Pre-COVID, CellPath was growing at 40% a year. In fact, it was up 80% the first quarter before COVID hit. Post-COVID, we are seeing it at a pace that's much stronger than that. Source, LDPath, the combination of the businesses, is now the leading outsourced pathology services provider to over 150 NHS trusts, private hospitals. We have the largest consultant pathologist network. That's important because as demand goes up, we need to make sure we can manage the operational capacity, which we can. Our digital pathology platform we had before we acquired LDPath is accredited, UCAS accredited and validated. However, LDPath is better, and we're going to take their system and launch it into the market. And I'm perfectly comfortable saying that. And right now, digital pathology represents 25% of the combined business. LDPath was 75% digital pathology in their revenue stream, which was, when we found that out in due diligence, we were extremely impressed. You can see just some financials, and I don't really want to spend a lot of time on this. I mean, you can see that the CellPath business itself was up almost 80% last year. This Ref Lab, we're moving into a precision medicine business, which I'll talk about under Genomics. What I really want to talk about is, well, one, the gross margin's up, which is great to see. This is really more us managing the fixed costs of having a lab, and once you get to a certain point, your margins go up. But look at this. This is actually pre-COVID right here. You see, COVID took this down to almost nothing. I mean, this was really not a good situation. Right about here, we see it going back up to pre-COVID levels. Then you've got Omicron here, and now you've got this spike, and this is continuing to increase. This is elective surgeries coming back on board that have been delayed with the COVID situation. We are geared up for that. We've been preparing for that. It's one of the reasons we acquired LDPath, and we are very bullish on the coming, not just year, but years of supporting the need for outsourced cell pathology for our customers. This is the way we're looking at our market. I just want to go through this. This is sort of important. The smallest piece here is there's a shortage of UK pathologists, similar to radiology. There's just not enough pathologists to do the work in the NHS. We've got a large network of pathologists that can help support the need to do pathology as an outsourced service. So there's a trend to outsourcing because we've got the capacity to do it. On top of that now, you've got the COVID delays in surgeries that have created this bolus of casework that's coming in. On top of that, now you've got regular pathology coming back online because not everybody's been waiting in line. There's more cancer going on all the time. It's a growing segment of the market. Lastly, you've got this structural shift to digital pathology, and if you can move from a 5 to 7 day turnaround time to a 24-hour turnaround time, that is going to reduce this. But the more people get into digital, the higher volume of casework you're going to be able to do because you've increased your operational throughput. Once you get this, there's probably another wave which talks about artificial intelligence, which means you can use software basically to determine which cancer cells are cancerous versus not. Pathologists still need to sign off on those, but that's pretty basic work. They'd rather focus their time on more complex cases, and that's going to be the next wave once digital takes in. And there's just no way the NHS is not going to be able to we're going to help do it. We're going to be part of this. I will say the LDPath team, the senior management team staying with us, they are driven to change the way pathology is done in the UK. They're just a great group of people. Very, very happy to have them part of the Source family. I think I've covered this. Yeah, I've kind of covered this in the points here. We talked about artificial intelligence, shortage of, I've covered all this stuff. But I won't spend time since we've got a time limit on this. Did point out it's immediately earnings enhancing. Key strategic acquisition creates a dominant position in the space. I did want to point this out. This is what we're showing to our customers. Source was one of the biggest providers of CellPath in the UK. Been in the business a long time. I always sort of joke that we're like the NASA of the CellPath business, where LDPath is like SpaceX. I mean, these guys came in 5 years, revolutionized the market. 70% of their revenues are in digital. We have no revenues in digital, even though we had a digital system. So they've really come in and changed the way everybody's thinking about pathology in a way that we couldn't have done. So they've got a strong brand name. So we took the brand name, put it together with our brand name, and this has been very well received by our customer base. In fact, we announced this deal a week before the biggest Congress for Pathology in London, and the keynote speaker announced this deal and said how important it was to the pathology business and segment in the UK. And they generally don't get overly commercial at these congresses, and we were very pleased to have her say that. So this is who we are now, a much stronger business, and as you've seen the growth curve I showed earlier, we're going to be able to continue to grow the business in a way that we couldn't have done without LDPath being with us. Let's talk about genomics. It's a second of our three core business, 5 million revenues. Was impacted a bit by COVID. It's back, it's coming back strong. We consider genomics to be the study of genes to progress clinical research and drug discovery. There's other ways to do genomics. People do in-home genomics tests. We don't do that. We're helping drug discovery and clinical research. Outsourced model is preferred by this segment. Pharma biotech companies don't want their employees doing basic sequencing. They'd rather outsource it, have the results come to their staff, and they can do more drug development and research. Basically, two types of sequencing. Sanger sequencing, which is an older technology, but it's still the gold standard for research and genomics. It only sequences one strand at a time. NGS, next generation sequencing, is massively parallel. When you talk about sequencing human genomes, it's NGS. We've got a high level of capability in Cambridge, and we are in fact moving our site to a larger site. We're taking some of the kit we had from the COVID days and moving it into Cambridge to allow more services on the drug development side, extraction services, et cetera. So we're repurposing some of the kit and moving it to a bigger site in Cambridge. We've invested in Illumina systems. We talked about that. A very strong commercial team. I will say that initially this business didn't have a strong commercial team. We've brought in a very good team that knows the industry, knows how to quote business, knows connections. So it's been a very strong part of the increase in this business. And then this precision medicine business, we've created this and we're rolling it up under genomics. We've got a reference lab in Nottingham that is basically additional pathology services that our customers want after we've done the basic slide looking at a tissue sample. An example would be, for example, EndoPredict. It's a Marriott assay. We've got a relationship with Marriott. We're an exclusive provider in the UK, where if you have breast cancer, the EndoPredict test will tell you what the best chemotherapy treatment is for that particular patient based on their genome. So that's the type of personalized medicine that's moving forward. We believe we're at the forefront. We're not the absolute front, but we're making sure we take advantage of this type of personalized medicine, precision medicine, as I would just say everyone around the world is getting more proactive in managing their cancer rather than reactive. Good business. I think that's all I need to say on that. Financials, I will say this, we've strategically spent more time getting into NGS, and you can see this is a 100 scale, so the business is growing, but the percentage of NGS is much bigger. We wanted to do that. Better projects, larger projects. Margins, I'm not overly concerned. This is a scale issue with NGS. Once you get to a certain level, that's going to go back up. We want this to be 40-45% gross margin, and I think we're going to easily achieve that. Stability storage. This is an interesting business. It's the third of our core businesses. Stability storage is a requirement. Stability storage data is a requirement for drug compounds and drug development to make sure the compounds going into drugs are stable and that the drugs that are finally finished, the finished product of those compounds, remain stable for at least 5 to 10 years, whatever the regulatory requirement is. So we offer stability storage chambers which mimic environmental conditions around the world, humidity and temperature, and you've got to show that everything's remaining stable. So we do stents, we do medical device equipment, we do finished products, we do raw materials. Very important part of the regulatory regime for not just drugs but also consumer products. Storage, our storage business is over 50% of this sort of division. It's a high margin, 80% recurring revenue business. These are contracts that last 3 to 5 years. It's basically a REIT. So you're putting in your products, they're storing it in our facilities, and we're charging you to do that. So it's just a very solid, dependable revenue stream. We do have storage services. We do manufacture and sell equipment. That's a picture of one of our pieces of kit. Service and validation is also a very important part of the business where we can go in, service the kit, validate the kit, and even validate other manufacturers' kit. That, we believe, is a growing part of the business. That's also very profitable. It's the second largest piece of this business. Storage growth is driven by capacity. We have increased capacity in Ireland and the US. Long-term commitments, I mentioned that, and equipment sales drive service, but we believe if we get into an OEM situation, we will have more product to sell with a variable cost rather than a fixed cost. So that's what I was talking about with respect to masking the service. It's a lumpy business. It's $1 million, $1.5 million a year. It's not really impacting the top line. It's costing us a lot. Storage, you can see even right here, you've got manufacturing's down 12%. Storage services is up 7% this year. Actually, it's up about 12% in the UK, which is our largest site. We did get impacted in Southern California, where we moved our facility from LA to San Diego. And during COVID, there was a pandemic in San Diego, so we couldn't have our customers come and validate and audit our facilities in San Diego, which we are now getting back. So that's actually a higher number. Service and validation was impacted by COVID. You can't go visit a site when you've got travel lockdowns. How am I doing on time? I've got 4 minutes, all right. I think that's it. Infectious disease, we can talk about this. I don't want to spend a lot of time on it. Generated significant earnings. I will say this, this is a Nottingham-based operation, and it was a career experience to watch a group of people put together an operation that went from 0 to about 100 million pounds in 1 year, 1.5 years. It was unbelievable. People working 24/7 all the time. It was an adrenaline rush for everybody in the business, and I couldn't have done it without everybody being involved. We are doing an orderly scale down. We know that the volume's not there the way it was, and we're going to make sure that this stays part of our offering, but it's not going to be core. Summary and outlook, 2021 was a strong year for us. I mentioned that before. PCR tests that generated earnings enabled us to invest both organically and strategically in M&A. The Cambridge move is more of an organic investment. Focus is going to remain on accelerating growth of our core business units as the demand for COVID declines. This LDPath opportunity, we are convinced it is a step change in the way people do pathology in the UK and across the world. We did complete the LDPath acquisition, encouraging growth opportunities in both genomics and this precision medicine business, which I really think is going to become a very big part of our business. Strong balance sheet. We used $18 million on the LDPath deal. We've probably got another $15 million cash. So we will continue to look at acquisition opportunities in the LDPath space. We're looking at one right now that has offices in the US and around the world. We're also looking at a small precision medicine business that could add to our precision medicine portfolio. So we're not done acquiring, but we want to focus on the organic side of our business as well and make sure we're investing properly in the basic sites that we have. So that's all I have. I can open it up for questions now, and I've got 2 minutes left, but I'm glad I got done in time.
Jay, thank you very much. Okay, do you have any questions for Jay? Gentleman here, please. Chris, thank you.
Could you talk a little bit about IP? My only experience in the medical field was where a UK company had supposedly infringed the IP of a US company, and that infringement was used to shut down what was a revolutionary innovation in medical treatment. You seem to be everywhere with IP. I mean, how's it work? Who's got the IP? Not you.
To be honest with you, that's a very good question. We're a lab services business. We're agnostic on IP, generally. Before LDPath, we had no IP. We're basically running services for other companies. Myriad, whatever the test is, we'll run it. It's not our test, it's their test. We're offering the service. LDPath does have IP, but it's a proprietary LIMS system and a proprietary AI software system that they've paid for. They own the code, and it is IP. So one thing I didn't mention about LDPath is they've got the ability to plug in their LIMS systems to the NHS hospitals in a way that we're almost going to become a tech model where you can charge monthly fees for your technology in addition to your pathology services. So IP is not really a big concern of ours, and I'm very happy that LDPath has this proprietary LIMS system is what we're going to call it.
Jay, I had a question about the LDPath acquisition. It's about the culture, keeping the corporate culture of innovation. How do you keep the management engaged and kind of keep them innovating and keep developing new technologies?
It's a great question. We have a very good relationship with the LDPath management. I know Alistair now very well, who's the founder. We're very well-known pathologists in the UK. They are committed to making this change in CellPath. I asked, they were approached by other companies at about the same time we approached them, and they chose us because they like the fact that the two of us combined can do more than they could ever do on their own. And I asked them, do you want to stick around? You're going to get a paycheck. He said, I want to stay around, I want to birth this baby, and they are committed to making this thing work. So it's a great business. In fact, I want to transplant that mentality into Nottingham, where our CellPath business is. So I've been through acquisitions before in previous jobs and previous experiences, and it's really important to keep the management team engaged and keep the culture of the company alive. That's critical, and we're going to do it here.
Lovely. Any other questions for Jay, please? I'll hold this for you if that's all right.
Just a question about LDPath. You said you have to install digital scanners in hospitals.
Yes.
Who pays for it and who operates them?
Good question. Right now we're finding out there's a lot of NHS trusts that have digital systems sitting in closets because they don't know how to use them. Two, we could offer them to them as a reagent rental model. But East Kent, for example, basically their pathology department was just completely a mess, I mean, to be nice about it. And they came to us and said, look, we'd like you to take this over. We put in 2 digital scanners. This is LDPath. Reagent rental model. They've taken the whole pathology business out, and they're running it as a service. There's another trust we have, I won't mention the name because we're still involved in it, who had 2 Hamamatsu scanners, and we're just plugging in the LIMS system and we're getting them up and running. They couldn't do it on their own. They can do it with us. And if they use our LIMS system, they don't need the infrastructure. They don't need the CapEx spend. They don't need the IT. We can run it for them. And so that, I think, is the model going forward with the NHS. They're tight on spending. They're tight on capital. We can do that for them.
So they would pay a monthly rental?
Pay a monthly rental, right.
How long are the contracts?
I think this one was 3. We want to pay the system back in 3 years. So after that, I don't think I don't know the actual details of post 3 years, but it's generally a 3-year deal with a minimum volume commitment, which is nice because you don't always get that with a standard agreement with the NHS. They can give you work, but if you do a lease deal, it's a minimum volume commitment, which is also something that they pioneered, and it's very impressive.
And you said you're in 150 trusts and private hospitals.
Yeah.
What's the market size?
I think in the UK they spend about $2.5 billion on pathology a year right now. I would say 15% of it's outsourced, and that's growing. So that's about the size of the market. But definitely as the move to digital happens, more of that's going to become outsourced. So we think right now it's probably a 250 million pound space, and it's growing.
Sure.
Good question on the who operates the scanners, your staff or the hospital staff?
If we put one in a hospital, the hospital staff does, and we train them up. We are going to put 2 scanners in Nottingham, and we've already got scanners in Chichester, which is where they've got their lab. We're running the scanners, and we do it ourselves, when we do it for them. Because we will take slides and scan them as well. That's a big part of our service.
I had a question on the genomics business. Who are your typical customers?
We've moved from being mostly university-based and research-based to big pharma and small biotechs. Cambridge is a great place to be. We've got AstraZeneca. We've got a lot of big pharma. We've also got some small pharma. It's basically the core of our customer base.
Okay.
So you're sequencing?
We're sequencing.
Yeah. There was something on the telly just the other night there, a US university doing sequencing. The machine room was huge. It reminded me of the 1970s.
Okay, do you know what kind of sequencer it was? Do you know what it was?
Vanderbilt.
Well, Vanderbilt, yeah. There's a lot of sequencing going on.
Huge. I couldn't believe. This is going back. What's that? 50 years, practically.
Yeah.
Back to when I was at university.
Yeah.
The bloody room is this size, full of machines, just doing genomics.
Everything's being sequenced. Everything.
But the technology is antiquated. The money tied up in each of these boxes. It was a room this size, full of boxes.
Oh, well then, that's unfortunate for them. We don't have room size.
The money tied up in these machines must have been vast.
We buy Illumina systems, and they're, probably the size of a large, they probably fit on that desktop, and they work great. And we've got a lease deal in place, so after 3 years we get a new system, and so we're on a lease program where we continue to upgrade our equipment. I can imagine if it's maybe Vanderbilt University, they're probably they have old kit. That happens. Yeah.
Illumina are a listed company. I think they're the kind of market leader in this sort of technology, aren't they? And I think you'll see if you invest in kind of Bailey Gifford funds, some of those tech funds, you'll often see Illumina in the top holdings for lots of these guys. They've been a big success story. Any other questions for Jay, please?
Thank you, everyone, for coming to this. It's nice to see people in person. Thank you.
Thank you very much. Thanks, Jay.